In this film, we will see some of the difficulties which a person may have after a stroke if they have dyspraxia. Dyspraxia is a perceptual problem, and it is the reduced ability to coordinate, perform, plan, or carry out specific movements even when there is no paralysis. If a person has dyspraxia, they may appear to be very clumsy. See how Greg has difficulty with the plug and the electric socket. He also has a problem putting the kettle on its stand. It is clear that he knows what he should be doing, but at times he seems hesitant. For example, when he is choosing the spoon from the drawer, he has to look and feel each piece of cutlery before he chooses the spoon. A way to help him would be to organise the cutlery drawer into sections like this, so that it would be easier for him to pick the correct cutlery. This also applies to kitchen cupboards or drawers. Declutter and add simple labels to the cupboards to make finding items easier. Planning and sequencing tasks is difficult for a person with dyspraxia. Now Greg is trying to work out what should come next in this task. He hesitates again when he gets the coffee on the spoon. He makes a mistake with the sugar, which he puts into the milk jug at first. Some people with dyspraxia will repeat the same action several times over and over again. This is called perseveration. Greg is not sure he has done the right thing, so he checks the cup and the spoon again and again. Notice how he looks a little awkward when he is spooning the sugar into the cup. This is also a feature of dyspraxia. Movements are either over-exaggerated or appear slightly odd. He hesitates again before choosing the milk jug. He spills the milk, and this is also common if the person has difficulty controlling movements. They may seem messy or clumsy. He stirs the milk instead of the coffee, but he works out the mistake for himself. To help someone with dyspraxia, declutter. Avoid distractions when the person is trying to concentrate on a task. Give a prompt. For example, look for the milk jug. Keep all items together. For example, in this task, the cup, kettle, coffee, milk and sugar were all ready to use on the worktop. Simplify tasks. For example, the kettle could have been left plugged into the wall socket. Be patient. Allow the person to attempt tasks for themselves. Give extra time for tasks. Make a simple list. Be aware of safety. The person with dyspraxia may not be aware of safety. Encourage practice. This way, the person can improve. Once they have mastered one part of a task, add another stage, and so on.